Welcome to my YouTube channel. So this is the next video in the series of PSM Practical for third MBBS professional exam. So in this video we will learn about immunization sports. So immunization sports, in this you will be given a vaccine and you have to tell about its contents, diluent, disease prevented, age at which it is given, dose, route and site of administration, adverse reactions or complications and contraindications, and storage or cold chain and protective efficacy. So you have to tell all that. And so there are many vaccines. The name of the vaccine is will be written on that vaccine. The label will be there, so you can identify by that. So first one is the BCG vaccine. BCG vaccine content, it is live attenuated vaccine, and it is diluent is normal saline, and disease prevented is childhood TB and miliary TB. Age at which it is given at birth. Dose, route and site is dose is 0.05 ml for less than 1 month and 0.01 ml for greater than 1 month. Route is intradermal, site is left upper arm. Adverse reactions: prolonged ulceration, local abscess, axillary lymphadenitis, osteomyelitis, and disseminated infection. Contraindications are generalized eczema, infantile dermatosis. Now it is stored at 2 to 8 degrees centigrades. Protective efficacy for miliary and meningeal TB is 75 to 86%. Next is the oral polio vaccine. So oral polio vaccine is a live trivalent vaccine and attenuated vaccine. Age, first dose it is given at birth, then 4 doses it is given, then 0 dose 3 weeks, 3 weeks, and at birth 3 weeks, 10 weeks and 14 weeks, and then booster. So dose is 2 drops each 0.05 ml and route is oral. Adverse reactions are almost null. Vaccine associated paralytic polio is seen in 2 in 1 million due to type 3. Contraindication are immunocompromised state like HIV infection and steroid use. Now storage or cold chain, it is stored at -20 degrees centigrades in deep freezer and 2 to 8 degrees centigrade during the immunization. Protective efficacy is 70 to 80% and duration is lifelong. The next vaccine is hepatitis B vaccine. So hepatitis B vaccine, it is a killed vaccine, recombinant vaccine, monovalent or combined with other vaccines. Age is at birth 6, 10 and 14 weeks is pentavalent. Dose is 0.5 ml in children less than 10 years and 1 ml greater than 10 years. Route is IM, site is deltoid at left thigh in children. Adverse reaction are fever, malaise, vomiting, diarrhea. Contraindication is hypersensitivity to any component or allergic reaction to the previous dose. And it is stored at 2 to 8 degrees centigrades. Protective efficacy is 98 to 99%. Then is the liquid pentavalent vaccine. It is combined or can be mixed. Age is 6, 10, 14 weeks. Then dose 0.5 ml, site interlateral aspect of mid thigh. Route is deep IM. Adverse reaction is local inflammation and mild fever. Then contraindication is hypersensitivity to the previous dose. And stored at 2 to 8 degrees centigrades. Protective efficacy is diphtheria 90%, pertussis 80%, hepatitis 98%, and influenza B is 95%. And now is the measles vaccine. Measles vaccine is a live attenuated vaccine and it diluted sterile distilled water. Age is 9 months, then and second dose at 16 to 24 months. Dose 0.5 ml, site is upper arm right, route is subcutaneous. Adverse reaction is fever and rashes. Contraindications are immunocompromised individuals, and it is stored at 2 to 8 degrees centigrade with protective efficacy of 95 to 100%. Next vaccine is DPT vaccine or diphtheria, pertussis, tetanus vaccine. Diphtheria and tetanus are toxoid and pertussis is the killed vaccine. Then it is plain, adsorbed or combined. Then age is 6, 10, 14 weeks is pentavalent. First booster at 10 to 18 months and then second at 5 to 6 years. Dose is 0.5 ml, site is anterolateral mid thigh right, left, and route is IM. Adverse reaction: pain, redness, fever, due to pertussis content and neurological complications, convulsions. Then contraindication is localized or generalized reaction to the previous dose and history of convulsions. 2 to 8 degrees centigrade temperature at which it is stored, and protective efficacy: diphtheria 90%, pertussis 80%, and tetanus is 90 to 95%. Next is tetanus TT vaccine. Its contents are: it is a toxoid and 6, 10, 14 weeks as pentavalent. Dose is 0.5 ml. Site is deltoid in adults and enterolateral thigh in children. Route is IM. Adverse reaction or complication is hypersensitivity, pain, fever, malaise. Contraindication is allergic reaction to previous dose, hypersensitivity. Stored at 2 to 8 degrees centigrade. Protective efficacy is 100%. Then vitamin A solution, age 9 months, then every 6 months for 5 years after 18 months dose. Then dose and route of administration and dose measurement method is: dose is 0.5 ml, route is subcutaneous. Adverse reaction: toxicity, dermatitis, hypervitaminosis A, headache, loose stools, vomiting. Contraindication is uh, child suffering from serious disease, reverse diarrhea. Storage in 100. uh, it is stored in dark room away from the in cool and dark room away from the sunlight at room temperature. Then rotavirus vaccine contains diluent and disease prevented, contain live attenuated vaccine, liquid preparation, and then diarrhea is prevented, rotavirus infection, and 3 doses given at 6, 10, 14 weeks. Dose is 5 drops. Site is mouth, route is oral. Route of and adverse reaction is risk of intussusception. Contraindication is fever, allergic reaction to previous dose. Stored at to minus 20 degrees Celsius up to district level, and 2 to 8 degrees centigrade at sub-district level. Measles, mumps, rubella vaccine content to diluent is the live attenuated vaccine. Diluent sterile distilled water. Age is first at 9 months, second dose 16 to 24 months. Dose is 0.5 ml. Site is upper right arm. Route is subcutaneous. Adverse reaction is fever and rashes. Contraindications are immunocompromised individuals and stored at 2 to 8 degrees centigrades. Then hepatitis A vaccine, live attenuated and inactivated vaccine. 2 doses, first dose 12 months and second dose 16 to 18 months. Then dose, route and site of administration are: it is 0.5 ml. Adult doses, it is adult dose 1 ml at IM, 1 ml IM, and adverse reaction is local reaction, pain, swelling, redness. Contraindication is severe allergy. Then stored at 2 to 8 degrees centigrade with protective efficacy of greater than 95%. Then chickenpox vaccine, it is live attenuated vaccine. First dose given at 1 year. Dose is 0.5 ml and then outer aspect of upper arm. Adverse reaction is fever, pain, swelling. Contraindication is if immunocompromised. Then storage or cold chain 2 to 8 degrees centigrade. Then is typhoid vaccine, liquid polysaccharide vaccine. Then it is given at 2 years of age, then every 3 years. Dose is 0.5 ml. Site deltoid. Route is IM. Adverse reaction is fever, headache, redness. Contraindication is allergy to any component of the vaccine. 2 to 8 degrees centigrade. It is stored at 2 to 8 degrees centigrades. Anti-rabies vaccine, it is killed vaccine. It is neuro tissue or tissue culture or modern tissue culture vaccine. Dose is 1 ml IM at 0, 3, 7, 14 and 28 days. Dose is 0.1 ml ID at 0, 3, 7, 2, 8 days. So there are different regimens. Adverse reaction is erythema and pain. Contraindication is hypersensitivity, and it is stored at 2 to 8 degrees centigrades. Then is the tetanus TT vaccine, toxoid. It is 6, 10, 14 weeks, is pentavalent. Dose is 0.5 ml. Site deltoid in adults, enterolateral thigh in children. IM, and hypersensitivity, pain, fever, malaise are adverse reactions. Allergic reaction to previous dose and hypersensitivity are contraindications, and it is stored at 2 to 8 degrees centigrade with protective efficacy of 100%. Then inactivated polio vaccine, it is killed vaccine, formerly inactivated vaccine. Diluent normal saline 2 fraction. It is the 2 fraction doses given 6 to 14 weeks, otherwise 4 doses. Then add doses 1.1 ml right upper arm intradermal. Then adverse reactions are pain, swelling, redness, joint pain. fever, allergic reaction to previous dose are contraindications, and it is stored in 2 to 8 degrees centigrade in the ice-line refrigerator. Then last is pneumococcal vaccine, which is polyvalent polysaccharide conjugate vaccine, and then age is 6 and 14 weeks, booster at 9 months. Route is dose is 0.5 ml, and route it is IM, and right anterolateral aspect of the thigh is the site. Then adverse reaction is reduced appetite, irritability, and fever. Contraindication is previous history of hypersensitivity, and storage or cold chain 2 to 8 degrees centigrade, most not to be frozen, not to be frozen. Next is the cold chain. So cold chain is the system of transporting and storing vaccine at recommended temperature from the point of manufacture to the point of use. So this is often asked in your vivas. So why is cold chain important? Because vaccine are biological product, they lose potency with time and process is irreversible. So we have to assure the potent product and vaccine programs, ensuring maximum benefit from the immunization and compliance with the manufacturer. So that is why cold chain is important. So cold chain storage, it involves walk-in cold room, deep freezer, and iceland refrigerators. Walk-in cold rooms are present as regional level, and storage up to 3 months can be done. Deep freezers, as you can see, at district and PSC level, temperature is minus 15 to minus 25 degrees centigrade. At PSC, used only for preparation of ice packs. Iceland refrigerators, these are both at district at PSC level, temperature is plus 2 to plus 8 degrees centigrades. Iceland refrigerator top opening can hold the cold air inside better than the front opening refrigerators. Now this is often asked that vaccine stability, or you can say sensitivity to heat. So the vaccine which is most sensitive to heat is BCG, then varicella, then MMR, then meningococcal C, then hepatitis B, and then DT, and HIB, IPV, or AP. Then sensitivity to cold will be opposite. So hepatitis B is most sensitive to cold, and DT, IPV, HIB, then influenza, then meningococcal C, then MMR, then varicella, then BCG. Then light sensitivity is also asked: BCG, MMR, varicella, meningococcal C conjugate, and DTaP. Now in vaccine storage there are some do's and don'ts. So do's are: you use a dedicated vaccine fridge, safeguard the electric supply, not more than 50% full, place vaccine in clearly labeled plastic mesh baskets, group vaccines by the type, and defrost or calibrate the fridge regularly, ensure backup facilities if in the event of fridge failing. Don'ts are: no food or medical specimen should be kept in it. Do not place fridge in direct sunlight or near heat source. Do not store vaccine for more than 1 month at PSC. Do not store vaccine in the fridge doors or in soiled plastic trays or container within the fridge. Keep vaccines away from the fridge walls and cold air vents. Then transporting equipment include cold boxes, vaccine carrier, and day carrier. So cold boxes are used for transport of vaccine. Fully frozen ice packs are placed at the bottom and side, as you can see in the picture. DPT, TT, and DT should not be kept in direct contact. Then vaccine carrier used to carry small quantity of vaccine, 16 to 20 vials. For out of reach session, 4 ice packs are used. Then day carriers used to carry very small quantities of vaccines, 6 to 8 vials. For a nearby session, 2 ice packs are used in it for only 2 hours period. Then use of diluent specifically designed to reconstitute the vaccine to volume, pH, and other chemical properties, stored at plus 2 to plus 8 degrees centigrade in the ice-like refrigerator. Then last is the vaccine vial monitor. It is a label containing heat sensitive material. Is placed on vaccine vial to register the heat exposure over time. Means it is a label, it will show color changes if there is some heat exposure. So the in stage 1 you can see inner square is lighter than the outer circle. Then in second stage, inner square is still lighter than the outer circle. In stage 3 the color of inner circle matches the outer circle, and stage 4 color of inner circle is darker than the outer circle. So in stage 1 and 2 we can use the vaccine, but in stage 3 and 4 we don't have to use the vaccine, and inform your supervisor. So that was all about immunization sports. If you like this video, please subscribe to my YouTube channel and share this video to your medico friends. Thank you.